Hello everyone, my name is Desiree and I am a musculoskeletal physiotherapist. In this video, I'll talk about hip joint. Your hip joint is known to be a ball and socket joint. Now the name comes because of the appearance of the joint. The two bones that form your hip joint are your thigh bone, that is the femur, and the pelvis bone. And the socket that the femur sits into is known as the acetabulum. The femur, the head of the femur looks like a ball, and the acetabulum is like a cavity. So your femoral head sits into that cavity, giving it its name, that is the ball and socket joint. Now, to hold this joint in position, there are a lot of tissues and muscles around it, and the anatomy of the hip can be divided into 3 layers. The deepest layer being the bone itself. So the ball and socket joint, that's the deepest layer. To hold this joint in position, you have the second layer, that is the ligaments of the joint capsule. And then the third layer are the tendons and the muscle group around the hip joint. There are 4 muscle groups which hold the hip joint in position. So the first one that I can name is your gluteal muscles, which is your buttock muscle. There are 3 gluteal muscles that hold your hip joint in position. The second one is your quadriceps muscle. These are a set of 4 muscles which are also attached around your hip and your pelvic joint, and then go and run towards your thigh bone. Then the third one is your hamstring muscles, which is a set of 3 muscles. And last but not the least are your groin muscles. Those are also called the adductor muscles. So although your hip just looks like a one teeny tiny joint, but it's surrounded by a huge group of muscle sets. Now the hip joint is known to have maximum mobility. That is because it can have 6 types of movements. One is the flexion, that is when you take your leg straight ahead. Second is the extension, when you move your leg behind. The third is the internal rotation, in which when you stand, you turn your toes in. And the next is the external rotation, when you turn your toes out. Then comes the adduction, where you move your leg close to your body or to the opposite side of your leg. And then the last one, the second last one is the abduction, where you move your leg away from your body. Last but not the least is the circumduction, where you can rotate your hip in a circle, like a clockwise or a anti-clockwise position. So these are all the movements that are possible around the hip joint, only because of the ball and socket alignment. So I'll just demonstrate it to you. This is your ball and socket joint of imagine this is your hip joint. So when you do a flexion, your leg goes ahead. When you do extension, it goes all the way behind. Internal rotation is this, it turns inwards. External rotation turns out. And the adduction is when it turns in. Abduction is when it turns out. And the rotation is clockwise and anti-clockwise. So can you see there are so many movements possible around your hip joint? So protect your hip at all cost. Now let me tell you a few interesting facts about your hip joint. The ball and socket alignment of your hip allows weight-bearing movements such as walking, running, jumping, stair climbing. All of these activities are well maintained or possible only because of this ball and socket alignment. The second fact is the strongest ligament, that is the iliofemoral ligament. It is one of the strongest ligament of your body. It is attached around your hip joint. The third fact that you may or may not know is the alignment of the hip in females is much more wider compared to men. Now this is only because it helps the female reproductive organs are around that area, and the alignment in female is wider so that it can aid in easy delivery of a baby during childbirth. Now let me tell you the common symptoms that are usually seen around the hip joint and its possible or probable causes. If you feel swelling, pain, achiness around your hip joint, which is after an activity, or if you feel it's because of some sudden twisting movement, then it's usually a sprain or a strain around your hip joint. If you're above the age of 40 or 45 and if you feel your hip joint gets stiffer, especially early in the mornings or when you're in a constant sitting position and you're trying to do a different movement, for example sit to stand or sit to walk, and if you feel a lot of discomfort around your hip and stiffness around your hip, then it can be a form of arthritic change. Now it could be osteoarthritis or rheumatoid arthritis. There is a possibility of joint arthritis or septic arthritis as well, but if it is septic, then usually you feel that the area around your hip joint is warm and it can also be swollen. The other thing is you might feel a bit of burning sensation around your hip joint if it is septic. You might also feel feverish or a bit under the weather but with hip pain. So these are symptoms of an infected hip joint. The other bit is a hip fracture. So if you've had a sudden fall, then you might, and you're unable to walk after a fall, and if you have that constant ache which just doesn't get away, and every time you do or turn your hip you have that pain and you're unable to bear weight on your legs, then it could be a possible fracture. But it is always advisable to go and get it checked out with a healthcare professional. So I would highly recommend you to keep these symptoms in mind, but do not self-diagnose yourself. If you've liked this content, then please like, share and subscribe to our channel. And if you want to know much more or a bit more information about your hip, then please write in the comments and we'll be happy to share more information with you. Take care and bye-bye.